Hi, my dragons. Okay, so this is attachment and aggression, part 2. We have learned how violence and aggression and attachment. Attachment is a moderator for violence and aggression in terms of depression, anxiety, and all other kinds of situations like that. And now we're going to talk about attachment as how it mediates violence and aggression and fear. Okay, so attachment and violence and aggression born of fear is something that we have researched. And I started this next PowerPoint. It's the PowerPoint says Chapter 14, Anger Born of Fear, Attachment, Violence, okay? And I started with my quote from the judge in court that said, "Every offender that comes before me has been abused as a child in some way or on some level," which I thought was very profound and has a lot to do with attachment and the topics we're talking about here. So early disruptions of attachment, the researchers have found that it activates your behavioral system. And not just your behavioral system, but your neurological system. We're going to talk about that in a second. So bonding with an attachment figure is like a safe haven in times of threats. So if the person doesn't get this, then they're on a downward spiral, and it triggers a lot of things like poor self-control, things that increase the likelihood of violence and aggression. And remember, we talked about Bowlby, who was the person who really did a lot of research on violence and aggression, and said that interpersonal anger is a result of poor adjustment, and it's a type of protest, even among young children, at the attachment figure who they want to attach to, but for some reason are not being able to attach with that. So usually as the person ages, it could be directed toward a romantic partner in the fear that something for childhood, some need in childhood went unmet with their attachment figure, and now they're fearful that this would happen again with their choice for their romantic partner. So for some people, when they fear that they may lose contact with that attachment figure, that triggers them to lash out in different ways. And so this comes after a real or an imagined threat of rejection, separation, or abandonment appears for the individual. So the violence and aggression in that situation can be seen as distorted or exaggerated, and it's a version of the behavior that is supposed to be functional. Okay, so a lot of research find that men tend to be insecure and overly dependent on their partners, and that jealousy and fear are common themes with separation, anxiety, and fear associated with poor attachment, which ends up in abusive situations. And as I said, we do have assessment tools that assess the strength of assessment bonds and things like that, attachment bonds rather. So the association between attachment, insecurity, and violence is well established and something that we do a lot of research on. So it's logical that people who have insecure attachments might have higher levels of violence and aggression towards a relationship partner and to families, because they just feel abandoned or separated. And their acting out is an example of their fear of that situation, separation. So Bowlby described a primitive attachment threat, so stress reactions, and that attachment, fear-based activation in the attachment system is similar to alarm reactions in animals. They find themselves alone, they find themselves separated from their parents, or God forbid they're abandoned, and you can hear little creatures crying out for their parents when they are lost or separated or, God forbid, abandoned. And this sort of thing sets up a chain reaction. You can see this hormonally, and we have done research on neuropsychology that shows that the whole system is activated. Hormones, including a release of endogenous opioids and things like that, okay? And this affects neurological development. So in infancy, a primary or primitive attachment is a sensitive time for neural development because they need to attach, and it helps the brain grow, okay? So especially the hypothalamus, the PFC, always the important PFC, and the orbitofrontal cortex, which regulates emotion, And these develop quickly, and so it's important that the child, even before they talk, experiences a secure sense of attachment. So if poor attachment occurs, then the brain functioning and the things that are supposed to happen do not happen. And since there is a critical period for those things to occur for optimal attachment and development, then we see a situation where that's not going to happen. So kids with poor attachment will develop a rage response. And you see this sometimes in kids. They say, well, they're having a temper tantrum, or they're having the terrible twos or something like that. It's all in an attempt to get that primary figure to attach to them. If they don't get their needs met and secure attachment doesn't occur, then they're going to have some problems later on in life. It's directed at the adult figure that they're trying to get the attention to. So positive interactions will help those systems develop. And it stimulates, we found in the research that it stimulates the reward center of the brain by releasing dopamine and endogenous opiates. And then neurotransmitters will in turn promote growth in the PFC, especially the orbitofrontal cortex. And that's, since it's the emotion-based, is very involved in the attachment process, okay? So attachment has a neurological path to play. And it's based on interactions with caregivers, okay? And this is in the first year of life. So this is before babies are even verbal. So if they experience a negative attachment, then later on they know they're angry about something and they may act out, but it's pre-verbal anger. So they won't be able to verbalize it as well as they should. So they have memories, but they don't have the words to describe those memories, that sort of thing. So it's a really interesting sort of thing. Bowlby and other researchers say that it is representative of family dysfunction, because you may have parents who they themselves have attachment issues, and then they don't know how to attach to their children. So the whole thing becomes a system of disorganized, disoriented attachment, okay? So they have marked impairments in emotional, social, and cognitive functioning as a result of this. And sometimes disassociation, which is a psychological term where someone disassociates from a particularly painful situation as it's occurring in an attempt to understand what's happening. So often you might see something like, you have childhood trauma or some kind of event that's happening, and you feel like you're watching it from a different perspective, or you don't feel like you're fully a part of it, or you may suppress it entirely and then not remember it, okay? So that's a disassociative state. So if it's a baby, then the baby will respond by poor attachment and not getting their needs met. And the result will be a whole bunch of different behaviors that are fearful, odd, disorganized, conflicted, that kind of thing. So for the parents, as I said before, it could be a result of their trauma and their poor attachment skills also. So the parents then, those types of parents, would generate what will be called a fright without solution in their children, okay, because they have no solution for their issues, and neither will the child, okay? So research has shown that kids with a history of disorganized attachment are at greater risk for hostility with their friends and other interpersonal relationships, okay? So a lack of trauma resolution can result in hostile or helpless behavior. So it can create frightening or paradoxical situations for the kid. So even if the parent has a secure attachment themselves, they may have some unresolved issues that they pass on to their kids, and their kids would become dependent on this strategy for getting attachment to get their needs met. So researchers have identified two different attachment styles that are continuous: attachment anxiety and attachment disorder. Attachment anxiety in college students are related to insecure attachment in their previous lives and their childhood and adolescence. So Coulsner found that subjects who scored high in an avoidance tried to deny their anger, but they had smoldering anxiety and things like that. Anxious subjects showed intense anger and a lack of anger control in that study. So Dutton, too, referred to that as fearful attachment, which is a combination of attachment anxiety, attachment avoidance, and fear, okay? And he also found that it correlated with an abusive personality for males as well. So this fearful, angry attachment style has some importance in male socialization, and it helps formulate what the researchers call an anger born of fear, okay? So Dutton found that the more anxious attachment styles, fear and preoccupied, were correlated with domestic violence and some spousal abuse reports. That means that they did studies on individuals who were, convicted or maybe incarcerated for domestic violence. And they did studies on research on how their attachment levels were, and then related it to the nature of the crime and their way of thinking as well. So the secure attachment style is not correlated with any of these sort of things, no abuse or things like that. And that was true for males or females. So, if someone has a really secure attachment style, then it's to benefit for both males and females. You saw no sex difference in the research. Henderson found that attachment anxiety was associated with women's violence toward their male partners. So more so for men than women with insecure attachment styles, but women as well. And then there was, Henderson identified preoccupied attachment. That was associated both with the perpetrator and the victim of violence, regardless of the gender. So that's very interesting as well. And then Bartholomew did a bunch of studies on the types of relationship that exhibited poor attachment styles and violence, and he did work with gay men and gay women and dating and cohabitators, not just married people, and found the same sort of issues and findings came about in those relationships too. So just because someone was married and in a relationship did not make them immune to these sort of attachment style findings. It was true for them as well. Also, there was research done on attachment style, abusive personality, and different personality disorders. Now, we do have screenings that look at personality disorders. Personality disorders are neuroses, not psychoses. So a psychosis is something that you think about as a continuous break with reality or a frequent break with reality. And these are more severe diagnoses such as schizophrenia, delusional disorder, all of those sorts of things. And personality disorders, while there's a tendency to categorize them as less severe, that oftentimes is not the case. And certainly there are times where people can exhibit symptoms of breaks with reality and have personality disorder. So it is rather severe. So don't get confused by, oh, that person only has a personality disorder. It's not as severe as something like schizophrenia, because there are times when both of those diagnoses can be equally severe. So they found that there's also a relationship between abusive personality, attachment insecurity, and borderline personality disorder. And borderline personality disorder is one of those that you see in correctional facilities that is very pervasive, along with the antisocial personality disorder. There is a marked tendency in borderline personality disorder to not experience remorse or regret or feelings of guilt after doing something that was aggressive or hostile. So you might see someone who has been convicted of homicide and they have borderline personality disorder and they have no remorse for what they did. So you see this also in poor attachment styles and violence and aggression with the personality disorder. So this is very pervasive and a very robust finding. Okay, so these findings were found in a lot of different populations that were studied, people with that diagnosis, and also Dutton found that there were significant correlations between fearful attachment, not just generally poor attachment, but fearful attachment as well. Borderline personality disorder individuals have impulsivity issues, and that people with poor attachment also had impulsivity issues as well. I'll continue with this topic on the next video, so stay tuned for part 3.